Welcome to Thriving with ADHD, a podcast where we'll share everyday practical tips to thrive in life as an adult with ADHD. This podcast is brought to you by Animo Sano Psychiatry, a behavioral health practice with a specialist ADHD clinic based in North Carolina. And this is your host, Nada Pupovac. Welcome to Thriving with ADHD, dear ADHD community. I am honored to have a special guest today. His name is Dr. Caleb Whiteneck, a psychiatrist who joined Animo Sano's team recently and whose specialty is TMS treatment for depression and OCD. As our listeners certainly know, ADHD as a condition is not usually present alone. People with ADHD have approximately 50% chance of having another associated psychiatric condition or comorbidity, and depression and OCD are some of them. TMS as a treatment modality is a proven method in helping treatment-resistant depression and OCD, and we are delighted to have Dr. Whiteneck in our team who will be able to provide more information about this type of treatment. Before we jump into the conversation with Caleb, here is a bit more about him. Dr. Whiteneck received his Doctor of Medicine degree from the University of Texas Medical School at Houston. After medical school, he completed his adult psychiatry residency at the University of North Carolina in Chapel Hill. During the last year of training, he was appointed chief resident over the large residency program. Dr. Whiteneck specializes in the diagnosis and treatment of women's mental health issues, ADHD, panic attacks, social anxiety, generalized anxiety, depression, and bipolar disorder. He utilizes TMS treatment for depression. When not working, Caleb, originally from Denver, Colorado, enjoys the mountains, snowboarding, good food, home brewing beer, and traveling with his family. Caleb, welcome to the Thriving with ADHD.
Thank you for having me.
As I mentioned in the announcement of the episode, ADHD doesn't happen in a vacuum, and it is often showing with other mental health conditions, and depression and OCD are just some of them. And I think we are very lucky to have someone with your expertise in our team who will be able to tell us more about treatment options when the usual therapy for these mental health conditions is just not working as it should.
That's right. Although, we specialize in ADHD, we also specialize in mood disorders, and it is really common to have multiple diagnoses at the same time. And case in point, when you're struggling with ADHD, a lot of times you're also struggling with either or both depression and anxiety as well. And kind of the triad of ADHD, depression, and anxiety I see pretty often.
So I really look forward to jumping into this conversation, and I want to get on with the first question. So what is TMS? This is an abbreviation. It stands for something. So let's clarify that. And how does it work?
Sure. So TMS is Transcranial Magnetic Stimulation, and it's a FDA cleared treatment for treatment-resistant depression. And it's a non-invasive treatment. So it's not a medicine and it's not a surgery. You don't go under anesthesia or anything like that. And it's an outpatient procedure. And it works and it treats the depression by stimulating the brain with magnetic pulses. Okay. We use the same strength magnet as an MRI, only you don't go in a tube. It's on the outside of just apparatus that sits on the outside of your head. And it sends repeated magnetic pulses, creating magnetic fields. And from physics, right, Faraday's law that a magnetic field over an electrically charged substance creates current. And so we create just enough current to actually fire the neurons. And it's a very
Okay.
focused uh, uh, magnetic field that fires only the neurons that we really want.
Mm-hmm.
And how it works, right, is okay, we're firing the neurons. Great. Why? What does that do? By firing the neurons over and over and over again, we can then create change.
Mm-hmm.
Okay. I look at it as sending your brain to the gym. You don't go
Okay.
to the gym
Mm-hmm.
once and then come out all bulky and big, right? You have to go and work hard at it, right? So
Mm-hmm.
we fire the magnet thousands of times over the course of treatment.
Mm-hmm.
And by doing that, it's stimulating the neurons to cause intracellular change, downstream effects with neurotransmitters, and an actual physical change. It's
Okay.
inducing neuroplasticity and causing increased connections between the neurons. We have a
Okay.
saying in the TMS world that neurons that fire together wire together. And that's really
Okay.
important for control of these really hard to treat sometimes symptoms.
Okay. My next question is TMS safe?
So
Yeah.
TMS is generally considered a safe procedure.
Mm-hmm.
As with any procedure, there can be some side effects, and so the biggest side effect that we are worried about is a seizure, and that's a big
Mm.
side effect, right? And so
Mm-hmm.
statistically it's less than 1 in 10,000
Okay.
patients will get a seizure with that, and that's why we do such an extensive uh, consult and looking at all of the history and making sure that each patient that we set up for TMS is as good a candidate as possible.
Okay.
And we ask probably about 5 different times in 5 different ways,
Mm.
have you or any of your family ever had a seizure? And so we really don't want that to happen, right?
Okay.
But generally, it's a quick outpatient procedure. The actual treatment lasts about 18 minutes and a half,
Mm-hmm.
and you will feel a kind of tapping or thumping on the left side of your head.
Okay.
And sometimes that can be it's a unique feeling. You've never felt this feeling before. And so it can take a little bit of time to get used to it, but it
Mm-hmm.
shouldn't hurt. There shouldn't be
Mm-hmm.
pain associated with it. Maybe some discomfort, but the
Mm.
word that we use is tolerable. It should be tolerable.
Mm-hmm.
And the first 2 or 3 days of treatment, you'll feel it more. And then by about the third or fourth treatment, your scalp kind of just desensitizes or tightens up, and it just very much becomes a routine
Mm-hmm.
procedure, and you come in, get the treatment, and then you leave.
Okay.
It
So,
can
yeah.
No, go ahead.
Yeah, I suppose maybe we can talk about. So you touched on this, how the session looks and feels like, but maybe you would like to elaborate on that.
Sure.
Yeah.
So your very first session with TMS, you'll come in, you'll fill out some rating scales and consents and
Mm-hmm.
paperwork and get that all out of the way. You'll meet the tech, you'll get comfortable in the treatment chair.
Mm-hmm.
We'll talk through what the apparatus is, the magnet and all of that.
Mm-hmm.
Then you'll get comfortable and we'll make measurements in the chair so that we it's repeatable.
Mm-hmm.
And the tech will have your chair all set up, ready to go for you each session. And so you sit down. I then take some measurements of your head and start trying to find the treatment location. And so
Mm-hmm.
that's a process that we use. We make little micro movements up and down and left and right and fire the magnet in single pulses. And what we're doing is we're actually looking for a movement in
Mm-hmm.
your right hand. So we
Mm-hmm.
stimulate the left side of the brain, but we're looking for a movement in the right
Okay.
because of the way that there's a crossover in
Yes.
the brain. It's pretty neat. But we're going to be able to stimulate your hand, and we're looking to try to isolate movements in your thumb or in between your thumb and pointer finger or your pointer finger. And that gives the computer a roadmap, so to speak, of
Mm-hmm.
how to calculate the treatment location. The treatment location is a very specific part of the brain called the left dorsolateral prefrontal cortex, or
Okay.
basically the kind of left front side of your brain. And
Mm-hmm.
that's where we're trying to treat. And the once we find that location, the computer calculates that for us, and then you're ready for your first treatment.
Mm-hmm. So, what patients can expect from TMS as a treatment?
Yeah. So the a good patient for TMS
Mm-hmm.
is someone who is depressed
Mm.
and has tried so many different medicines, tried, they've done their hard work in taking the medicine. They've gone to the appointments and they've been through therapy and they've tried so many different ways, but they
Mm.
just haven't had success in their
Mm.
treatment goals.
Mm-hmm.
That's a great patient for TMS because it's not a medicine. You don't have to worry about those kind of, chemical kind of side effects.
Mm.
And so what to expect is hopefully a big improvement in depression. The numbers are really, really good,
Mm-hmm.
and improvement numbers are just much better than any medicine that we have on the market.
Okay.
But it doesn't happen immediately, right?
Okay. Fair
So
enough.
just like remembering going to the gym, and it doesn't happen
Mm.
overnight. Most people don't notice anything that first week of treatment.
Okay.
So you get through the first week of treatment, then into the second week of treatment, some people start noticing small changes. They have a
Mm-hmm.
little more motivation. It's a little
Okay.
easier to sleep. Their energy might be a little bit better. Maybe their negative thoughts are not quite as intense or not quite
Okay.
as often. Something. They're noticing something, but they're
Mm.
still very depressed.
Mm-hmm.
By week 3, now we're starting to gain some traction, and
Okay.
symptoms are improving. Numbers are dropping on the depression rating scales, and there's a little hope building that, wow, maybe this is actually going to make a difference.
Mm. Mm-hmm.
Hopefully, by the end of treatment, there's been a steady improvement, a steady decline in depressive symptoms, and
Mm.
we reach remission of depression, meaning that on the depression rating scales, you don't even meet criteria for depression anymore,
Mm-hmm.
which that's our goal. Not everybody reaches that, but that is always our goal.
Okay. Okay. And I would like to wrap up this conversation with the questions we like to ask our guests. If there is one important thing you would like our listeners to remember from this session and this conversation, what that would be.
So I would want everybody with depression
Mm-hmm.
to know that TMS is a non-invasive option for treatment of the depression without changing medicine, without trying another medicine, but just that there is another option besides trying another medicine to treat the depression,
Mm-hmm.
and it works really well. And so don't give up hope. There is another option if medicine hasn't worked for you,
Mm-hmm.
and consider the TMS as an option for the treatment.
That's excellent. Thank you so much, Caleb, for this informative conversation. I am impressed by science and technology, and that it's now able to help people in mental health field. And there's loads of hope for our patients, of course.
Yes. It's so rewarding to
Yeah.
see people sometimes who have struggled for decades, 30, 40 years of depression, and within a few weeks give some relief that they've never had before. So it keeps me doing it, and just is encouraging to me.
That's fantastic news, and we are very lucky to have you on our team, and that this treatment option will be available to our patients. That's so amazing.
Thank you, Nada.
Thank you so much, and I hope to have you in some other episode so we can talk more about TMS. Thank you so much.
Sounds great. Yeah, bye-bye.
Thank you for listening to Thriving with ADHD. This show is produced by Animo Sano Psychiatry. Please follow, rate, or share our podcast on Spotify, Apple Podcasts, or any other streaming app of your choice. Music is by Daddy's Music from Pixabay. For more information about Animo Sano Psychiatry, please visit animosanopsychiatry.com.